I think one of the greatest things I've seen just in the last few years is how much more comfortable people are so much sooner after surgery, and how much quicker, therefore, they go home and get back their lives. One of the great concerns historically with hip replacements is that until it heals, the ball can come out of the socket. And I think one of the biggest things we've seen in the last 5 years is the precipitous drop in the number of dislocations, because we've gotten so much better, not just at getting the components and the correct orientation, but closing tissues and better bearings, and all these things have made a wonderful difference, and people can go into it with more confidence. I think one of the other major things I've seen since I began this 23 years ago is the scope of people who I care for. I continue to care for the old, and it used to be if someone was in their 80s, they were old. Now, my goodness, if someone's in their 90s or late 90s or even 100, but if they're mentally awake, they're mentally alert, and physically they're healthy, they do extremely well. If I look at the number of people in my practice now that are in their 20s and 30s and 40s, it's so much more, such a larger percentage than what we used to, and whether that's just because our techniques and our prostheses are better, whether it's because the whole attitude has changed. People don't want to live with pain. People want quality of life, and I really get that. I would feel that way. And because what we do now is so much more predictable. If done well, they have such a high probability of doing well.